for this opportunity. First, my name is Reverend Makiba DeBrew. I'm one of the millions of working individuals currently without health insurance. I'm among the millions who choose to work in a mission-driven company who serves the neediest of our country. This is the second time in 4 years that a workplace has discontinued my health insurance due to rising costs. And even if I could afford to purchase insurance on my own, to cover me as a woman would be double of the cost for my husband and my son combined. And I'm told by an insurance company, not private, public option, that I cannot have a child for the first year that I'm insured if I'm covered. So people are making decisions about how folks should be covered already, and it's profit driven. So my question is, how do you address the disparities for women, women of color, people of color under this health care plan, or any that you would propose? What would you do? How would it ensure that people are not dropped if they develop any chronic illness? And last, insurance reform is step one in the debate, but without health care delivery reform, the system will be overwhelmed. What are the provisions?
Talked about sort of the access point is pre-existing conditions, universal access programs, otherwise known as high-risk pools. Both parties agree on that. We could get that done. I also would tell you, as far as small businesses are concerned and agencies that you may be a part of, we really need to focus on expanding the opportunities for small businesses and individuals to purchase insurance in that market, not in the group market. And that's why you've seen over the years proffers by the Republicans say, let's have association health plans. Let's have more consumer-driven options. Right now, you can go out and get a health savings account. And I know our office has worked with several individuals who were unable to afford coverage in any other way but bought a health savings account. And yes, it requires give a family of 4 close to $5,000 if you have the problem. But you will never go bankrupt, because if, God forbid, something really happened to you, if something really happened and you were facing hundreds of thousands of dollars of bills, it's covered. At least it's something right now. It's not perfect. But there are these options out there. We should be promoting every bit of the ability for people to find the kind of insurance that we have. Now, you asked about wellness and about prevention. Bobby spoke about it, and HR 3200 tries to go to that. Okay, and it tries to do so in a way that you've got the Health Choices Commissioner saying this is what plans have got to do. Where we know, again, going back to the original context that we operate in this country, where most people under 65 outside Medicare get their insurance through their employer, almost 70%. Okay, if that's the case, we have models out there which show employers have demonstrated the ability to bring down, or at least hold costs steady. The way they do that is they encourage good behavior, if you will, prevention, wellness programs. They give people incentives to go about their life pursuing that. Right now, this bill takes away the employer's ability to do that. What we ought to be doing is looking at the law that governs these big group plans called ERISA. We ought to be giving these big employers who operate across the country, who provide most insurance, to be more flexible, to put incentives in place so that if you were an employee at one of those people, at one of those places, you'd have a reward for being about wellness, for being about prevention. Anything you want to add?
Disparities, while you're there, disparities.
Well, the disparities are going to exist in an insurance environment, whether it's the government insurance or whether it's private insurance. And there should not be any disparities in terms of access to care on any basis. Every one of us should have the opportunity to access coverage that gives quality care. And from where I am in the perspective, if you ramp up government's a role and you put more people into the hands of the government, you get a situation like we have with Medicare. It's unsustainable. And so we look to the other systems in the world, like the UK and Canada, how they handle disparities. It basically is imposed. It says if you reach a point or an age in your life, or if you're a certain gender, that gender is the one that contracts that disease, and we don't think it is cost effective and necessary for you because you don't have that much longer of a life and we need to put it to someone else, that's what happens. That's government dictated disparity. We don't want that.
Well, Scott, get another question.
Thank you, Reverend DeBrew. You asked a lot of different questions. First, on the minimum standards, I think somebody mentioned the possibility of an insurance policy covering everything except what they have. That's what the minimum standards are designed to do. You can't sell insurance that doesn't cover cancer. You can't sell insurance that doesn't cover diabetes. There is a minimum standard of services you have to provide. Employers, I think Eric indicated that employers keeping costs down. The fact is that costs in the last 10 years have doubled. They're expected to double again. We've got to do something. Two possibilities: the associated plans to have small businesses save money by coming together and saving money. That has been recommended over and over for the past few years. There's one problem with it. That is, if you get a bunch of healthy people together coming out of the system and going on the side and saving money, the studies are that 80% of the public, if we pass that thing, would see their rates go up. I don't view that as a solution. And if you have thousands of dollars to set aside every year for an HSA, then that will help you. But if you don't have the thousands of dollars to set aside, the health service accounts don't help you. But you mentioned gender. That is one thing I think everybody agrees to, that we're going to eliminate that disparity. Wellness and prevention. There no co-pays on preventive services. That will encourage people to get your checkups and immunizations. In prevention, there's research and best practices to make sure that physicians get the best information. And finally, you mentioned people get their insurance dropped. There's provisions in there. Once you have insurance, they can't drop you if you get sick. And finally, the idea that people who have done well won't lose their job, have access to Medicaid. In this bill, if you have low income, you can get onto Medicaid. But there's one problem with Medicaid. It's not only income, it's also assets. If you have any meaningful amount of assets, you have to spend down, go broke, sell off everything until you don't have anything. Then you can get Medicaid. In the meanwhile, you're just out there without insurance.
Thank you for your question. Appreciate it. Yes, ma'am. Welcome.